So if you're experiencing chronic pain symptoms, you certainly should try to seek out an upper cervical chiropractor before you ever contemplate the idea of fusing your bones in your neck because it's irreversible. In addition to that, though, we do take care of people in our practice that have had cervical spine fusion. Hello, I'm Dr. Lucas from Mountain State Wellness in Morgantown, West Virginia. Last week, myself and my staff spent some time at a local wellness fair here in Morgantown, West Virginia, screening potential patients that we could help in the community with a surface EMG technology. And while I was there, I got to speak to between 40 and 50 people in our community. Of those people, 6 people disclosed to me during my conversation that they had already experienced cervical spine fusion surgery. And all 6 of them basically admitted to me that after the cervical spine fusion surgery, that they actually had more pain and discomfort than they did prior to the surgery, and their quality of life has greatly decreased since having it. I explained to them that the procedures we use with the very gentle application of the NUCCA spinal correction or the upper cervical alignment process is extremely gentle and extremely safe for them to actually use despite having their cervical spine fused. Now, in my 24 years of practice, I have seen that typically it's the C4, C5, and maybe C6 vertebra in the neck that actually get fused. Those are the ones that typically deteriorate the fastest from degeneration or accidents or injuries. What I've found is that because we're really only adjusting the very top vertebra of the spine, the atlas vertebra, that we really cause no harm or no injury or no alteration at all to the fusion. Those 2 bones, because they're fused together, essentially operate as one singular bone now, and the amount of pressure that we put into the upper cervical spine is not enough to cause any damage or any kind of malposition of the fusion surgery. Now listen, there's a very small list of reasons as to why a cervical spine should actually be fused, and one of them is not chronic pain symptoms. So if you're experiencing chronic pain symptoms, you certainly should try to seek out an upper cervical chiropractor before you ever contemplate the idea of fusing your bones in your neck because it's irreversible. In addition to that, though, we do take care of people in our practice that have had cervical spine fusion. In fact, just this week, I finished up a 6-week segment with a 60-year-old woman who had cervical spine fusion about a decade ago. And of course, she consulted my office because her pain levels of headaches and neck pain had increased significantly after the fusion, and she was tired of feeling miserable all the time. After 6 weeks of care in my office of correcting her atlas vertebra and her upper cervical alignment, she reported back on her own survey an 80% reduction in the neck pain and the headaches that she was experiencing post-surgery. We've made a substantial improvement in this woman's quality of life. And so if you hear anything from this video, I want you to know that number 1, you should consider upper cervical care before having a fusion done on your cervical spine. Or if you already had a fusion done on your cervical spine, it's completely safe and very effective at actually correcting your alignment with our procedures, and it won't cause any harm to the fusion that you've had done. My name is Dr. Lucas Watterson from Mountain State Wellness in Morgantown, West Virginia.